two independent offices of the legislature, as we mentioned at the beginning, released reports that said Alberta's child welfare system is failing Alberta's youth.
Specifically, it's Indigenous youth.
It's Indigenous youth. And this is something, Paula, that I thought, what are they going to say new about this? This is something we know. This is something that we've had in the papers year after year after year. So, Emma, Paula, you were covering this report. What did they say?
So basically...
and who was it? Who was it and what did they say?
Yeah, it was the Auditor General and the Child and Youth Advocate. They both did reports, actually separately, but then I guess they had a conversation and figured out they were kind of writing about the same thing. And it found that Indigenous children are way overrepresented in the child welfare system. I think 1 in 10 children are of Aboriginal heritage, but there's 69% of those in the child welfare system. An Aboriginal, a First Nations child rather, is 30 times more likely to actually have contact with child services than a non-Aboriginal child.
Well, Emma found those numbers shocking. I didn't find them shocking at all. I've known that for a long time. What I found far more interesting were the numbers in Merwin Sahar, the Auditor General's report. The Auditor General has a very different role than the Child and Youth Advocate. And Del Graff's report was very beautiful, very overarching, very sort of macrocosmic about the breakdown of relationships between First Nations and the government and the long lingering legacy of residential schools. Merwin Sahar's report was absolutely straight up nitty gritty. And here's what he reported. The compliance rate for child caseworkers who are supposed to see their charges a minimum of 4 times a year is 16%.
That's like not even failing. That's like failing really, really, really badly.
Really bad.
I mean, if you got 16% on an exam, you would have to rethink your life's direction. So 16% of child welfare workers are in compliance with the basic standard that says they must check on children 4 times a year. In some cases, kids were going 7 months and longer without any contact with a caseworker.
We're talking about some gaps in the system here. You had an interesting story this week that on the surface seemed like a story just covering a particular incident and regarding medical equipment, but then it seems like there's a bigger issue that you've uncovered. So tell me a little bit about what Alberta Health Services put out this week in a press release about a North Edmonton medical facility.
Yeah, so this came out early in the week, and it was a press conference that an investigation had been done at a Northside medical clinic, and they had found evidence there that the clinic had not been properly sterilizing some of the instruments they use for skin invasive procedures. These are things like removing moles or draining a boil, something like that. They were not setting their sterilizer at a high enough temperature to kill all the pathogens, and staff weren't trained properly. And they found there was probably about 270 patients that they'd seen that may have been exposed to hepatitis B and C, and they want those people to get tested. The quote came from the college registrar, Trevor Tiemann, who said, "Yeah, they do a good job of getting the grimy bits off." That's how he described it. But they weren't so good at making sure that the tools, when they go into the sterilizer, that the sterilizer is getting hot enough to kill all the remaining pathogens.
Cleanliness is something we should just expect from our healthcare.
Well, it's one thing. I mean, if you go and have your toenails done at a dodgy nail salon, you might expect that you might pick up a foot fungus because they didn't disinfect the soaking dishes. But if I go into a doctor's office or a hospital, I do sort of expect that they sterilize the equipment. I don't think that's an unreasonable expectation.
I agree. And AHS agreed as well, right, Keith?
I would hope so.
Yeah.